Yes, hello everyone. So it's my great pleasure to introduce Alexandra or Ali Schmidt. She is a PhD student at the University of Sussex in her second year, and she's supervised by me and two clinical psychologists, Doctors Clara Strauss and Nick Gray. And Ali will tell you all about her project on looking at the predictors of common mental health problems in older adults. I just want to say a few words about Ali, because Ali is like the most talented student I've ever supervised, very hardworking, very organized. So she, in addition to her research skills that she shares generously with other members of the team, she is also teaching stats at the School of Psychology. She is providing mentorship to undergraduate students. So she is volunteering at the local charity organization that provides day-to-day support to older people. And she is also a full-time mom to her teenage son. So she is like a superwoman in my opinion. And now it's over to you, Ali.
Thank you very much for that lovely introduction. So I'll just share my screen. Okay, so thank you, Daya, again, and welcome to my talk today about my PhD on predicting the development and psychological treatment outcomes of common mental health problems in older adults. So with common mental health problems, I mean depression and anxiety, and older adults would be anyone over 65. So why is it important to study these common mental health problems in older adults? So here you can see population pyramids from the UK of today, 50 years back and 50 years ahead. And as you can see, the shape here is changing quite a lot. And there's more people living to an older age. However, despite this increase in life expectancy, time spent in poor health has also increased. And of course, with the current situation with COVID-19, the older population is disproportionately affected, which has an impact on both mental and physical health. And what I found extremely quite convincing when I read this recent report was the conundrum that older people face about being scared to go outside of their house because of COVID, but on the other side, also suffering from the isolation at home. So as I mentioned, depression and anxiety are highly prevalent in the older population, with 1 in 5 suffering from depression and 1 in 7 from anxiety. They're highly comorbid, not only with other psychological conditions, but also physical conditions such as heart disease and cognitive decline. And they're linked to an increased mortality in terms of suicide, but also in terms of worse prognosis for certain health conditions, physical health conditions. So my PhD, the overall aim is twofold. So firstly, it's looking to find out predictors on psychological treatment outcomes. And then also to look at factors that predict the development of these conditions in the first place. And today's talk is primarily going to focus on my systematic literature review. So with the systematic literature review, the aim was to systematically review and collate all the existing evidence that exists regarding predictors of treatment outcomes for psychological therapies in older adults. So to do this, I included quantitative population-based studies and randomized control trials. I looked at the population of adults 65 aged or above. I included any kind of recommended treatments, psychological treatments that are currently being used, and excluded any sort of drug treatment or combination of drug and psychological treatment. And in terms of treatment outcomes, I was looking at either clinical diagnosis status change or changes in depression or anxiety symptom severity, which is measured through a variety of scales, but one example would be the patient health questionnaire. So this process I went through started with database searches, which yielded just over 7,500 results, moving through title and abstract screening, filtering out some of the articles, going through full text screening, which then ultimately left 33 studies to include in the qualitative synthesis and around 3 studies for my meta-analysis. So a quick overview of the results. So of those 33 studies, there were about 2,500 participants with a mean age of around 69. The main conditions that were studied were depression and anxiety in about equal measures. And the main treatment studied was by far cognitive behavioral therapy and internet-based cognitive behavioral therapy. And predictors identified were across 5 different categories, with psychosocial predictors most commonly identified, followed by clinical and treatment related. And I'm now going to talk to you about each of them in turn. So in this slide here, you can see on the left-hand side factors that were associated with more beneficial treatment outcomes, and in the middle, those associated with less beneficial outcomes. And also I've included on the right-hand side factors that were being investigated, but that didn't seem to have an effect on the treatment outcomes. So I'm just going to bring out some highlights here of the findings. So in terms of most commonly studied predictor in this category was the impact of prior stressful life events. So how much a person was affected by those. And the one with the most, with the highest effect size was higher avoidant coping style, especially in generalized anxiety disorder, was associated with worse treatment outcomes. Moving on to clinical predictors. So the most commonly studied predictor overall was symptom severity at baseline. But interestingly, this went in both directions. Sometimes predicted better treatment outcomes and sometimes worse treatment outcomes. So it'd be interesting to look into this a bit more. Also quite interesting in terms of psychological comorbidity. So someone suffering from depression and anxiety, let's say, that was associated with worse treatment outcomes. But in the very few studies that looked at physical comorbidities, no association was found. Moving on to treatment-related predictors. So I think the main point here to mention is factors that kind of described how much a patient was engaged in the therapy seem to be associated with better treatment outcomes. So for example, better homework compliance or a higher number of sessions attended. Whereas, for example, the type of therapy or the level of assistance that the patient received did not seem to make an impact. Here, just briefly on neuropsychobiological predictors. So because a lot of treatments that were looked at were related to cognitive behavioral therapy, a few studies looked at cognitive or executive function type measures, but quite a lot of them did not have an impact, with the exception of cognitive flexibility. So this is how quickly someone can adapt their thinking style to new situations. That seemed to have an effect, but also here, interestingly, this went in both directions and was associated with both worse and better treatment outcomes. And lastly, socio-demographic predictors. So gender, ethnicity, or someone's occupation or income did not have an impact, but a higher level of education was associated with better outcomes. And interestingly, being married was associated with worse outcomes. So what am I going to do with all of these findings? So what I found in my systematic literature review will be informing my studies that I'm going to carry out to look at research aims 2 and 3 of my PhD. So in research aim 2, I'm looking to see if those predictors identified in the review are also evident in the improving access to psychological therapy services in the NHS. So these significant predictors that identified will feed into a questionnaire that will be distributed to IAPT service users at the beginning of their treatment. And we will then use this to work out later whether any of these had an impact on the treatment outcomes. So at the moment, I'm in the process of preparing the NHS ethics application with a view to start recruitment in early autumn this year. And then secondly, it will also inform my research aim 3. So this is where I'm looking at developing prediction modeling and looking at risk and protective factors of the development of common mental health problems in older age. So for this, I'll be using data from the oldest birth cohort study in the UK, the National Survey of Health and Development, to see what contributes to the development of these problems in later life. So in terms of using these findings in practice and the implication, so if we're able to identify who benefits from treatment most or least, this will then allow clinical practice to adapt and tailor treatment for individual patients, and then hopefully reduce thereby the need for healthcare systems and reducing societal cost, and ultimately promote healthy and happier lives for older people. So which leads me to say thank you for listening, and thank you to my supervisors, Daya, Clara, and Nick, for all their support and guidance. And lastly, to Mental Health Research UK for making all this research possible in the first place.